Hi, guys. We have a very special guest with us. But before we go on to introduce who she is, I'm sure she's a celebrity on YouTube, so I'll let Noora do that introduction. But before that, just want to tell you what this video is all about. It's always important that we start with the end in mind. And the end, in the case of a DDS applicant, is their opportunities to get a job. The fear of not getting a job, especially in the US, is something that cripples people and even stops them from applying 2 years ahead of that opportunity. So in this video, we have our guest who's going to dispel the myth and break the truth for us around how she got a job in the US after being an international student and completing her DDS program here. Having said that, I'll pass it over to Noora.
So I'm so excited to have Dr. Hannah today here with us. She was an inspiration to me during the process, and I'm so glad to have her here today to kind of guide me as well, along with you guys who are watching the video, to the next stop after completing DDS. She is a graduate out of the Colorado School of Dental Medicine. So without further ado, I'll have her take it along.
Hi guys, I'm Hannah Doan. You can just call me Hannah, and I'm practicing in Washington State right now, and I just graduated in 2018. So feel free to ask any question about jobs and finance and stuff.
Sure.
Perfect. She also has her own YouTube channel, so she's been really sweet to join us on this video. So thank you, Hannah.
This video is going to be in parallel, concurrently published on that as well.
On that channel as well.
So Caapid Simplified's first outside opportunity. All right. So maybe we'll start with the primitive question about in the basis of time, and when a person applies to DDS and gets into a school. After that point onwards, when should they first apply for a job, or when should they think about starting to apply for a job?
Yeah, so just like from my own experience, most of my classmates got a job offer or signed a contract like way before we graduated. So getting a job offer or signing a contract is not a big problem. It's really easy. I think only like 5 or 6 of us that got a contract after graduation. The job just like fall from the sky. To be honest with you, it's just a matter of choosing which position, which location you want to practice and you want to live with your family. That's all. But I think the earliest one that got a contract was in August. So it's like 4 months before graduation. And
Wow.
Considering that the program is only 24 months, so it's like really early.
Yeah, absolutely. So what kind of groundwork should a student do if they plan to get a job, say, for example, like 4 months before graduation, if somebody has to be on track?
Yeah, so I don't know about other school, but in Colorado, like we have the lunch and learn. You guys, do you have lunch and learn?
Yeah. Yes.
Yeah, so a lot of corporates, they just come in and give free lunch to students and talk about their corporate. And so even when I was in the first year in dental school, I just talked to them already. But I did not like actively seeking for a job until the second year. And starting from the second year, we had another like tons of lunch and learn and fair, vendor fair, and all those things. And I just like went there to talk to the representative from those corporate, and I just asked him or her like, hey, I'm looking for a job. I can start practicing in 2019. So do you guys have any open position in Washington State? Because at that time I know that I want to live in Washington State. So my like other friends also do the same thing. They just went talk to the representative and say like, hey, I'm interested in staying in like say Colorado, or I want to practice in California or the East Coast. Do you have any job offer over there? And so if they happen to have a job position over there, they can just say like, hey, sure, yeah, just give me your contact number and I will email you right away about the position available. So it's really easy. Like we don't have to apply for a job or anything. We just talk to them, give a contact number, they contact us right away for the job opportunities.
Are these people like recruiters who are looking for talent, or are they only from big corporate brand names like Aspen Dental is scouting for talent? So how do you get placed? Maybe if it's a private practice.
Yeah, private practice is a different different story. These are only like corporate. So these people they work directly for the corporate. They are the person of the corporate. So they are not like talent recruiter or anything. So we just contact directly to the corporate.
Mm-hmm.
And so there are a few big corporate in America, right? Like Heartland or Pacific. Those are the one that we always see in the school.
Mm-hmm.
In terms of private practice, it's a little bit more difficult. I like so I just look on Indeed or even Craigslist. There are tons of advertisement over there, which is a big surprise for me. I never think that I would try a job in Craigslist, but there's a tons of advertisement over there. So and then what else? Yeah, I think just like look Google, Glassdoor, Indeed, Craigslist, those things. So there will be job posted over there, and you just contact the owner directly. But for corporate, it's a little bit easier.
Awesome. Sorry to interrupt your flow, but when you apply, let's say you pick up a number from Craigslist in northern Seattle, you give them a call and say, "Hey, I'm looking for this opportunity." Do those dentists view international DDS students differently from the students who come through the 4-year DDS program? And if they do so, what are those differences they look out for?
So I cannot speak for everyone, right? But I think it also depends on the state. If they are more conservative side or they are more, but from what I've learned from Washington State, they do think of us a little bit differently because they know that we already have the experience. So they consider us to have more experience and know how to talk to patient more, maybe. Considering with the 4-year DDS program you grab. So I talked to one representative from a corporate, and she told me that if they offer like $500 a day base for a 4-year DDS new grad, they will offer us a little bit higher, like 550 or 600 a day. Yeah.
Nice. So this is a question that many people suffer with when they try to choose a school. When you apply for jobs, does the brand name of the school make a difference, or is there what is it important which school you come from?
No, the school doesn't matter. It matters like your personality, how you talk to patient, but they don't really care like where you graduate from. Like I tried to apply for a multiple job and none of them asked me where I graduate from. They just asked me when I graduated from, which year to see like how much experience I may have, but not like where. So for me, when you choose a dental school to apply, the first thing checking the tuition, because for me, the less loan you have, the better life you will have in the future. And so just like don't rush into those California dental schools because they are so expensive, like New York, so expensive. So just choose the school with a more reasonable tuition. The second thing that you need to look at is like how many patients that you will see in the school. Because I know some school in a state that have like five dental schools next to each other, they will have to compete for patient. And then I have other friends from Ivy League school as well, and they don't have as many patients to see as we have in Colorado. And so I think it's more important like how many patients you see and how much exposure you have clinical skill with the skill, not with the brand name or anything.
I have to highlight this portion of the video for so many students out there.
Yeah, don't rush into those schools. Brand name doesn't matter.
So this is like a key insight. I think in summary, the two big things that Hannah mentioned was, of course, the number of clinical cases you kind of practice over, which talks about your quality of work. And the second and a big significant one is communication. Now, even if quality of care you provide might depend on the number of patients you see, communication is not people dependent or quantity dependent. It's something that you can actively hone just by watching other patients and watching faculty the way they speak. But it seems to be one of the biggest factors for a dentist selling themselves, even through schools, to get a job. So, yeah, communication.
Yeah, and to add to that, I also want to say that one of the important factors she mentioned was to look at the tuition of the school when you're choosing schools, because absolutely you want to try to reduce the loan amount as much as possible, because we're not taking a loan for $100,000 or less than that. It's going to be way more. So yeah, I completely agree with her on that.
Yeah. Was there something that you learned in school or that you did not learn in school that it seems to be really important or unimportant in the real world?
Yeah, no, those two things are the things that I learned after I applied to Colorado. When I talk to my friends, and then talk to other, oh, I joined those Facebook group for dentists in the US, and they all share the same thing, like choose a school with less tuition and with more clinical experience.
Mhm.
So a little bit more is that, so I've heard that some school have the requirement for graduation with only like 5 crowns. So
Yeah.
for a student that graduate from dental school and doing only 5 crowns in the school, it's like almost nothing comparing to another school that they don't have all the residency program. They don't have like endo, they don't have perio, anything. So the dental student that graduate from those schools, they can see, they can do implant placement themselves, they can do endo themselves as well. And so they will have like way more experience than some student graduate from a big brand name school. So that is the difference. Like if you hear like more clinical experience, that you think like it's just like 5 crowns and 10 crowns, but it's not the same. This is like 5 crowns, maybe one endo in their whole dental school time, versus the other student has like implant placement, veneer, third molar, endo, something like that. So it's like a huge difference.
For an experienced dentist like yourself who comes into DDS, how much does getting involved in these other extracurricular activities like ASDA or these mission trips or outreach events? I mean, whether it's possible, it's a different question, but people, at least they're ambitious about it. They aspire to take part in these extracurricular activities on their applications. Do these things actually count when it comes to applying to jobs, getting involved in these other activities, or would you rather invest your time focusing on clinics? Okay.
No, it just doesn't matter if you join like Mission Mercy. What is the name of I don't remember. But yeah, I did not join on those programs during my dental school time, not because I don't want to, but because I don't have time. I don't know about other school, but the workload in Colorado is insane, and so I finished all my requirement, I think like the week of graduation. Some of my friends, they are luckier in finding patient and have big cases to do. And they can finish their requirements like 2 months before graduation, then they will have time to do those things. But for me, I did not have time. But like some of my for the DDS program, I mean for the 4-year DDS program in Colorado, they have the ACTS program, which means that basically the 4th year in dental school, they just travel to other sites like 4 or 5 hours away from Denver, and they join in those community clinic, and so they can practice there under the guidance of another doctor over there. And so that is a huge advantage that they can just practice like normal, like other doctor before graduation. But so we can join those programs if we want to, if we finish all the requirement. It's just that maybe like one among 40 students that can finish requirement that early.
So you know how you said that representatives will come to the school for lunch and learns, and you get to interact with them, and through them you get a job opportunity. So how important is it for students in dental schools to go to conferences like AD annual meet or Midwest Dental Conference or something like that? Is there an opportunity for them out there?
Yeah, there are opportunities everywhere, I guess. So I went to ADA conference in Hawaii, like before,
Hey.
Yeah.
mainly because it's Hawaii. um, so there will be representative from other corporates over there. But again, like you already have the access from the dental school, so it's not a reason why you go to a conference for that.
That's
Nice.
interesting.
So it does seem like it's an easy process from what Hannah says. So another question that we had was for students who do not have a green card or are not US citizens, is the process different or is it a little more difficult?
It is a little bit different because if you need a sponsorship for the work visa, then most of the time my classmate will sign with a corporate instead of with a private practice. Just because the corporate, they have lawyer, they have HR department, they have everything. So they can, they can deal with the paperwork. Private practice, they don't want to deal with all those paperwork. So, so you mainly just work for corporate. The good thing is that there are jobs everywhere. As long as you don't want to stick to, California, Washington State, New York, then you will have opportunities everywhere. Of course, my classmates still have job in California. Not that they don't have it; it's just like more difficult.
Okay.
But if you are willing to move to like Ohio, Indiana, Illinois, there are tons of opportunities there. And so the only bad thing is that, not bad thing, but the limited, the downside is that when you work for a corporate, you are under the contract for like 1 or 2 years, right? And because you are in the process of applying for the work visa, you cannot just like buy, quit, like that's enough here. You just don't have that advantage. But you will have to stick to that job for until a year later, until you have the work visa process. So it's I I don't know. It's not like a disadvantage or anything. It's just that you have to stay in the job longer. For my first job, I also worked with a corporate, and they did not have enough patients for me, so I walked away around 4 months after I joined them. But like with a doctor that need the work visa, they will have to stay there for at least 12 months, no matter what. No matter if they don't pay you as much, or if they don't have enough patient for you, or some of my friends, the corporate did not have enough patient for them in that clinic, so they want my friends to travel to another clinic. So it's a lot of driving every day. Like every day they work in a different clinic. So those are the real reality with have needing the work visa. And also after you finish with the contract and you already have the work visa, and now you want to find another job, you have to apply again to move the work visa from one place to another place. So it's like a lot of paperwork involved. But none of my friends are unemployed, so that says something, right?
Yeah. Okay. So getting a job is not difficult, but of course, paperwork is the same as any other H-1B out there. I think that's reasonable. And I mean, if you have job security, there isn't an equivalent to that let alone satisfaction that comes after. If I were a dental student, I'm not, but if I were one, and my goal was to minimize my loans as much as possible. And let's assume I have dependents either in my home country that I have to sponsor or in the US with me. What do you think is like and let's say the world is my canvas, I can settle down anywhere in the US. What would be like the golden approach to take?
So this is not only for international student, but also for the 4-year dental student as well. So the same advice is to move to those states that is not so competitive. like those states that I just listed out earlier, like Ohio, Illinois, those states in the middle. Don't go to the coast, like it goes to west coast.
Okay.
Then you will be fine. And because of the cost of living in those areas is less, so you will have a better life quality as well. So your salary will be higher because they want you to move to those states. And at the same time, the cost of living is less, so the remaining, the leftover is higher. Then so you can have a bigger saving account comparing to if you move to California. So for a new grad for the first job, most of the time they offer like $500 a day only, and the cost of living is like overwhelmed. So you are left with nothing over there. So if you can move anywhere, that's the best scenario. And for me, I'm single, but because my family live in Washington State, so I'm stuck here. Not that I'm stuck here, but because I choose to live here only. But I did not even consider to live elsewhere. Maybe Colorado, but not. No, I'm not. I just want to live here because I know that I will be happier here. But if you can move freely anywhere, then that's the best.
I think that is like a key insight. This is not the case with a non-dental profession, simply because for most other professions like mine, when I'm consultant, we get our salaries drastically reduces or shrinks depending on the cost of living of a certain state. So if I were in my same job working in the Californian branch, my pay is higher compared to Illinois. Whereas in dentistry, it's the other way around, which I find very inspiring. The supply-demand issue. We have patients here, they're underserved. There's higher demand, meaning they're going to pay higher to call you in, and your cost of living is lower, so your savings actually increases.
Yeah,
that's brilliant.
Yeah, so for me, my first job, I was offered $500 a day, and it's a corporate as well. And my other friend got offered around like I think $750 a day, and that is in a rural area in Texas, like 3 hours away from Dallas.
Okay.
So like way higher.
In Texas, where there are no taxes.
Yeah.
Nice. That's great. Maybe another question about long term, right? If a dentist comes to the US and let's say you're starting with the $500 per day salary, that's pretty much what a employee at a really good consulting firm in the US would earn as well. As you go through the years, do you think the kind of hike that a dentist gets in their career is higher? What's your general notion about that? Or do you think people consider dentists to be more wealthy because they have the opportunity to also become entrepreneurs at some point in their life?
Yeah, so I think dentistry is like one of the best career because you can become an entrepreneur. So we will dive into that later. But in general, the more you work, the more experience you have, and the more connection you can build with the patient, which means the more production you can produce for the clinic, then the higher salary you will have. The 500 is more like a starter job, but then if you keep working on yourself, you take more CE and you can produce more and your speed is faster, then of course you can produce like way more than 500 a day. So I just don't want to, like leave out the name, but one of my colleagues, so she earned like more than 20,000 a month.
Oh.
Yeah, and she's not the only one.
A month?
Oh. Yeah, she's not the only one. She worked like crazy, but she earns a lot. So, so I would say that it depends on yourself. Like, how much is enough? If you want to earn more and more, and you take on all those CE courses like implant and ortho and sleep apnea, then the potential is unlimited, I would say. But if you are happy of working part-time 3 days a week, you just want to do bread and butter, like some fillings and dentures and some crown, some bridge only, then whatever make you happy, then it's good.
No, I want to change careers. Can you make me a dentist?
No.
Like 20,000 a month. It's not anything for new grad, to be honest. Like, it's really exhausted.
Interesting.
I also wanted to ask, this is a question that just popped into my head right now. So, what do you think is the effect of COVID-19 on current jobs and future job opportunities? What do you think it is?
I would say for people that graduate this year and the next year may be the one that hit the hardest. But if you graduate 2 years from now, it should be fine.
Oh,
The industry will survive it. So for now, like even with my clinic, it's a Medicaid clinic. So we were extremely busy before, like 5 days a week or sometimes 6 days a week, and 30 patients a day, and only me, like the only doctor there. But for now, we had to cut down to 3 days a week. First thing because it's not, a lot of patients, they are scared of going outside, and people that they are not so scared of going to a dentist, they may not have money, or they don't have the insurance anymore because they got laid off, and so that's why the flow is so slow in my clinic. But I've heard from other doctors that their clinic are still busy as usual, so it depends on the location, I guess, and what type of clinic it is. Like, is it a PPO, Medicaid, something like that? It depends. And because it's slower, so like my clinic before, they plan to look for another doctor, but now they don't pursue that anymore because they want to wait for everything to get over with before they look for a second doctor. So of course the job opportunities there will be less than before. So that's why I say it will, people graduate this year will get hit the hardest, but eventually I think everything will be fine.
That's resounding. Thank you for that. I guess we had like an amazing time speaking to you about job opportunities. Very, very enlightening conversation. I'm sure like this will help so many people who are, they've built their own ideas about what job opportunities look like, and
for those who are confused over it, like, is it worth going through this difficult process of getting to the US to do their DDS? And it looks like you answered most of their questions around that, hazy part.
Do you have any final words that you would like to share, for the community out there in terms of jobs?
So I would say, we pick the right career to pursue, and the potential is huge. It's just that it comes with a lot of hard work. A lot of day that I just go home and I just don't want to go back to the clinic. Lots of day I went home, I just like cry in the car. Like it was so exhausted. So like money will come, you will have enough money to pay the student loan. You don't have to worry about those things. You still have the comfortable lifestyle. It just comes with a lot of hard work, but I think it comes with any career out there, right? Dentistry is not the only one. And there are, good side and bad side. I still think that I choose the right career, but keep in mind that like some of my friends, they feel like they got stuck in dentistry as well. So everyone is different. It depends on your personality, I guess. And I just want people to know the good side, the bad side of every decision. And so just don't expect too much. Expect like we have extravagant lifestyle, like with Tesla car and mansion and all those things, without working so hard. So it's not like that. But it's not like we live a miserable life, like eating instant noodle all the time. Not like that either. So we are in the middle range. And I think things will get better with the future. I'm just graduated 1 year ago, and I believe that things will get better for me in the next 3 or 5 years.
It definitely will. You made our day. Thank you, Hannah.